Okay, Yulika, so very nice job today.
Thank
I
you.
know it's been a long shift.
Yes.
So let's debrief on your day.
Okay.
So, and feel free to use your notes. We have Epic here if we need to look at this. So first of all, tell me a little bit today about what did you notice with your patient this morning?
So when I started my shift, she was definitely a little tired. Her blood pressure was on the lower side, and she was tachycardic and had a little bit of fever.
Good. Okay. Perfect. And that sort of, you notice those trends were looking a little bit different than in previous shifts, right?
Yes.
Okay.
Yes.
Good. So those trends are really important to sort of look at.
Yes.
So let's talk about the interpretation of those trends. So specifically the heart rate and the blood pressure and that oxygen saturation. Tell me a little bit about that.
Yes, so her blood pressure was low, and it was actually trending down through the course of the day, and then her heart rate was trending up.
Okay.
So that told me that she was definitely hypotensive, and her oxygen requirements were also going up. So she was on room air this morning, and then we had to put her on nasal cannula to keep her oxygen saturation.
Exactly. And then it looks like that heart rate had been in about the 90s to about, and it had jumped all the way up to the 120s, right?
Yes.
And then what about the blood pressure? What sort of trend did you see there?
So it was trending down from like I think it was 110 for systolic when we started, and then it was in the low 90s.
Exactly. Good. Perfect. All right. So let's talk about the really quickly the labs. So I know you drew the labs. So what when you think about the white count and the lactate, what did that look like to you, and how did you interpret those values?
So her white count this morning was 11.4, which is elevated.
Yep.
And then the lactate was 4.2, which is also high. It should be below 2 or so.
Exactly. Good. So what were you sort of thinking when you saw those vital signs?
So something with infection,
Yes.
something related to infection.
Exactly. Very nice. Good. Okay, so let's talk about responding. So, we got all of these values, we went to the provider, we did some little more, work here, and how did you respond today?
So after I talked to the provider, they ordered fluids, IV fluid bolus, and blood cultures, which we drew, and then after that we started a new antibiotic that they ordered.
Yes, exactly. Very nice. And did we give anything else for that temperature?
We give Tylenol.
Good. Okay. I think I forgot to ask you about that. So we also noticed there was a little bit of jump in that temperature, right?
37.6.
Exactly. Good. Perfect. Okay, so let's talk about reflecting sort of in action. So what did you notice when you gave, for example, the fluid bolus or when you administered oxygen?
So when I administered oxygen, her oxygen went up.
Okay.
So it was 92 on room air, and then it was 97 on 2 liters nasal cannula.
Okay.
And then after the fluid bolus, I noticed that her blood pressure went up, and then her heart rate went down from 118 to 102 after the bolus was infused.
Good. Perfect. Very nice. So, and then we were able to start those antibiotics, the new antibiotic. And then what about the Tylenol?
And then the Tylenol, her fever it took a few hours, but it went down from 37.6 to 37.2.
Yes, perfect. Very nice. Okay, so then when we think about reflecting on action, sort of when you look at this whole day, this was your first patient you said you had cared for that, had sepsis, right?
Yes.
So what are some things that you learned?
So I learned that in sepsis it's important to monitor vital signs because the blood pressure will be dropping, heart rate will be going up, and then her respiratory rate was also elevated. And I noticed that her skin was warm and flushed.
Okay.
And then, I think that the patient history is important as well because she has a history of UTI, which is a risk for developing sepsis.
Exactly. And it's really nice that Epic has that banner now, right? So it sort of can help clue us in. If it sees all these labs and vitals trending, it sort of gives you that clue like, hey, are you looking for sepsis here? Good. Okay, so let's talk about social determinants of health. I know we talked a little bit about this today when we met with the social worker. That was a really great idea, just sort of bring in the social worker for an interdisciplinary team. But what are some major things you kind of picked up on?
So I know from the notes that the patient had a UTI 2 weeks ago, and she was treated for it, and then didn't finish the course of antibiotics. And I think it's probably because English is not her first language, and I don't think that she was educated well enough, or maybe just didn't understand. I don't know if they use an interpreter. How important it is to finish the antibiotics.
Yes, and that's sort of what she shared with us today, right? When we had the interpreter, is that she didn't realize that she was supposed to take that full course.
Yes, exactly.
And why did you choose an in-person interpreter today over using the iPad and the phone interpreter?
Because she's also hard of hearing, so that's something that, you know, sometimes those phone interpreters they are just not very, you know, the patient often can't hear them.
Right.
And it's just a lot better to have somebody in person, especially if education is so important for patients, like positive outcomes.
Very nice, good. So then lastly, what else could you sort of, now that we know that, you know, she wasn't sure about this discharge planning, exactly what to do, and we know that she lives alone.
Yes.
But she did talk about she had a daughter. So is that something that you want to maybe think about trying to involve her?
Yes, I think that we should ask the social work to follow them after discharge, and then also see if we can get the family involved so that they can keep an eye on any, you know, possibility of symptoms occurring in the future and know what they mean possibly.
Perfect, great. Okay, well, I think this was a great learning experience for you today.
Yes,
very nice job.
Yes. Thank you.
Won't be the last, sadly.
Thank you.